one of the main challenges for doctors today is the fact they must write so many notes and summaries. So today, I'm very happy to meet with an interesting company that is tackling exactly this challenge. And together with me is Koen Bonenkamp, a co-founder of Autoscriber. Tell us a little bit about the story behind your company.
Yes, thanks for having us. Yeah, we are a company that is founded in 2021, so about 2 years ago. And we didn't start the company ourselves. We were approached by an actual doctor and internist at the Leiden University Medical Center who was struggling every day with this massive amount of admin that he has to do. And he thought AI can maybe solve that. Going to record the conversations and AI is going to write the note for us. And we started developing it. And I loved it so much. The application, but also I think the technical challenge of having AI understand humans, that I decided to full-time focus on it and launch Autoscriber.
I invited Jacqueline Kazmaier, co-founder of Autoscriber, to join me and share with us a few of her insights. Jacqueline, can you tell us how Autoscriber actually works?
So our software records the entire conversation between doctor and patient and captures the transcripts with separated speakers. And what we do in real time then is that we extract relevant clinical information from that, and we actually automatically produce the summary that the doctor normally would have written himself. So within a few seconds after the conversation has ended, you are actually presented with a pre-calculated version of your clinical notes, and therefore the doctor doesn't have to write them himself during the conversation.
Jacqueline, I wonder if you can share with us what you identify as the major trends in this industry.
Right. Well, so we've seen a big uptake in AI in the last couple of years, and that's come in two major waves. And the first was more focused on medical imaging. So we saw a lot of that in radiology, where they were using AI for diagnostic support and for scanning and just reducing the workload by actually filtering out which items need to be looked at by a human and which don't. And now we've seen a second wave with the rise of large language models like ChatGPT, where the question is, how can we use AI that understands human language to actually help reduce administrative burden on various other tasks? So we've seen some applications in mental health where chatbots driven by generative AI are actually holding conversations with patients before the doctor needs to intervene.
So efficiency is the ultimate goal.
Yes, I would say so. So we've had a lot of media attention on the diminishing workforce in healthcare. So efficiency is becoming more and more important. Great. So on the left-hand side, you can see the transcript of the conversation, and that actually flows in real time and is separated according to the different speakers. So the doctor on one side and the patient on the other side, with the important medical terms highlighted. And on the right-hand side, you can see the summary in the structured headings as it will appear in the patient file at the end of the day. And this is what was automatically generated by our software from the conversation on the left-hand side. And there you can also select the different formats that you would like a summary to be presented in. So this is now our standard hospital format, which has all of the headings that are traditionally recorded in the hospital setting.
And the last question for today is for you, Jacqueline. What kind of a golden tip you can offer decision makers in the healthcare system when they're looking at implementing new technologies?
What we've seen often, especially with big hospitals, is that there's usually quite a long process to get something really implemented at full scale in a hospital. But what we see is that if you really want to have an impact in practice, it's really a good idea to start very small. So start with the most minimal version of an intervention or a product that you want to adopt so that you can get very quick feedback.
And I know that you mentioned that you have a standalone version. Maybe this can be a kind of a soft landing, no?
Exactly, yeah. So obviously the end goal of our application is to be fully integrated in the workflow and with the EPD providers as well. But to get started quickly and to just see what kind of impact we can have.
Thank you very much. I wish this discussion could be done in the Autoscribers. It's a good idea.